you heard? Rodents are taking over. According to various news articles, recent COVID-19 related disruptions have caused abnormal behaviour in rodents, making them become more aggressive. Don't let your home or business be invaded with a disease-carrying rodent infestation. Keep them away with Plug-in Pest Free. G'day, I'm Scott from Plug-in Pest Free. Using the active wiring in your home or business, Plug-in Pest Free goes to work keeping rodents and pests away the more humane way without using toxic poisons or other harsh pesticides. Just plug it in. It's that simple. Now that's fair dinkum. Stop the infestation and order yours today at gopestfree.com and receive a free hand sanitizer pen with every order using promo code INK. That's gopestfree.com, promo code INK. GoPestFree.com, promo code INK. Don't spray and regret, plug in and forget.
It is 8:08 in our AM 560 traffic center. The latest now with Jim Telemonte.
On Chicago's south side, there's a fire, 38th and Wentworth. On the inbound side of the Kennedy Expressway, delays start at Cumberland. It's now 35 minutes O'Hare to downtown, much quicker in the Express. Outbound 25 minutes to the airport. Inbound Eisenhower, looking at 52 minutes, 390 to downtown after a collision at Austin. Outbound 36 minutes. Inbound Stevenson, 48 minutes, 355 to Lakeshore Drive. Outbound, it is an hour and 40 minutes. Everything is jammed. First Avenue to County Line, where everything is blocked. And County Line in 83 due to a major wreck. Inbound Ryan, 19 minutes, 95th to downtown. Northbound Tri-State, there's a crash at Roosevelt in the right lane. I'm Jim Telemonte on AM 560, The Answer.
Chicago's Morning Answer continues next in our AM 560 Weather Center. Cloudy and breezy and a high of 38. Currently 27 at O'Hare. Next news at 8:30. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
We have proclamations, new proclamations from Lord Master Tony Fauci, a couple that present some good news and some potentially challenging news, depending on your perspective on masks, I suppose. The good news, Amy, is that if you've been vaccinated, you can now hug your mom. That's the good news. Mm-hmm.
I was so excited. Yeah, we played that last week, and I went, oh, really? I'm still hugging my mom, and I'm still hugging my children, too. I don't need Dr. Fauci, who hasn't seen a patient in, 40 years, to tell me that.
I actually prefer, I don't really handle my family relations so well, so I appreciate Dr. Fauci coming in and handling them for me.
Oh, yeah, here he is.
If you're vaccinated and you have a member of your family vaccinated, someone that's not lived with you, can I sit down and give them a hug and things like that? And the answer is very likely, of course you can.
Oh, thank God.
It's fantastic news. That's a real breakthrough in combating COVID and getting back to some normalcy. Now, the less positive news comes yesterday. Tony Fauci on CNN, of course, with Dana Bash fielding softballs, and suggesting that, he definitely agrees with President Biden that we should be back to something resembling normalcy, as however it's been redefined or will be by then, by the end of this year. However, he is very possible. He could conceive a situation where we would not stop wearing masks until well into 2022, which is sort of an odd perspective considering, at least according to Dr. Marty Makary at Johns Hopkins and Columbia's Bloomberg School of Public Health. Per the 77% drop in COVID cases over the last 6 weeks, we're tracking for herd immunity by April, is what he wrote.
Not July or not by next Christmas?
So again, the need to continue to abide all of the newly minted protocols for dealing with the pandemic, even after the combination of natural immunity, infection and survivors of the infection, and the vaccinated, essentially make the virus de minimis in terms of its public health impact. It's very, very confusing. So to help us try to get some clarity, we're pleased to be joined again by our friend Dr. Joel Zinberg. He's a senior fellow at the Competitive Enterprise Institute in D.C. and an associate clinical professor of surgery at the Mount Sinai Hospital in New York. Dr. Zinberg, thanks for joining us. Appreciate it.
Oh, you're very welcome. Good morning.
Good morning. So the mask wearing that will go into 2022 potentially, even as you have respected public health professionals just as credentialed as St. Fauci, who are saying we're tracking for herd immunity early spring.
Well, look, I think I've written multiple times over the past few months that I think we're headed for herd immunity earlier than Dr. Fauci had indicated, because you get to herd immunity when people can resist the transmission of the virus, and that's either because they've been naturally infected and they are now immune, or because they've received the vaccine. And the CDC and others have indicated that far more people have been actually infected than we have confirmed cases, maybe 8 times as many. So if we have 25 to 30 million confirmed cases and you multiply that by 8, you're talking about most of the population has already been exposed and probably immune. So you don't need to vaccinate the entire population to get there. So I think we are probably looking at sometime this spring reaching the approximately 70%, 75% of the population having immunity that's necessary to stop the transmission of the virus.
And then Dr. Fauci said yesterday, if you did have COVID, you need 1 vaccine instead of 2 vaccines.
Well, I did not hear Dr. Fauci's comments, so I can't respond specifically, but we've known for quite a while now that you get a fair amount of benefit from just a single vaccine. And here we're talking about the vaccines from Moderna and Pfizer that are 2-dose regimen. But we do know you get a good benefit from that, and that's been confirmed in multiple places already. But to get the full benefit, the 95% effectiveness in stopping you from getting COVID disease, you need to get both doses.
So is there a scientific reason why, after herd immunity is achieved, you would still abide mask wearing and 6 feet apart and so forth?
Well, probably not. You'll have to keep track of how the case counts go, and whether they continue to fall. But every year we have a flu epidemic, and we manage to get through it without widespread social distancing, without mask wearing, because we ultimately reach herd immunity. Between people who get infected and between the number of people who get vaccinated and the natural, course of the virus that sort of peters out, we managed to do it without these mitigation measures. I mean, to be safe, you should continue mask wearing until it's sort of all clear. It's uncomfortable a little bit, but it's not the worst imposition. But we ought to really be looking very closely at reopening the economy, getting kids back into school in person, and those are things that are far more important than the mask wearing.
Well, also in terms of some post-mortem on all of this at some point, again, going back to Dr. Macary's op-ed in the Journal, he does some back-of-the-envelope math with respect to some things we sort of now know, or the numbers seem to indicate about natural immunity, plus where we are with, 1 in 6 Americans being vaccinated at this juncture. And he suggests that we have a population fatality rate of 0.15%, which is approximately the seasonal flu. And so shouldn't there be some difficult questions asked about all the destruction that was wrought? And particularly when you have light touch states like Florida outperforming lockdown states like New York and Illinois, shouldn't there be some questions about what exactly it was that the new policies that were pursued, the lockdowns, what exactly they produced and what exactly they cost?
I've written for months now that the fatality rate, when you consider the true number of infections, not the sort of phony confirmed numbers. In other words, what people don't understand and what's broadcast by the media constantly are the number of confirmed cases. Those are the cases where people have actually gone in, gotten tested, and the test is positive. But not everyone gets tested. And what's been clear for a very long time now is that most cases of COVID are either asymptomatic or the symptoms are relatively benign, so that people don't even go to get tested. So that's where we come up with the realization that far more people have actually been infected with the virus, but then have had confirmed cases. So we've known for a long time that that's the situation. We've known for a long time that the true fatality rate is a lot lower than what has been broadcast based on the confirmed cases. So, whether or not these severe measures were necessary is a very important question. And again, as I say, I've written for a very long time that these lockdown measures, shelter-in-place measures, the closing all the businesses measures are extremely destructive, and they have their own health effects, which probably in many situations outweigh the effects of COVID directly.
Dr. Zinberg, let's move to New York and Governor Andrew Cuomo's DOJ, FBI investigating his nursing home debacle. First, we thought 9,000 died. Now it turns out 15,000 people died in nursing homes. What do you understand it happened there?
And before you answer that question, because I know you've written about him and you're there at Mount Sinai, I want you to react to what he had to say on Friday about what the real issue is and what he's going to do, the corrective action that Governor Cuomo is going to take.
We did not aggressively enough take on the misinformation that caused people pain. And it caused pain for grieving families. And that's what I regret. I'm not going to make that mistake again. If you're lying to the people of the state of New York, I'm going to call it out. If you are lying in a report, I'm going to call it out. If you're lying in a newspaper because you have your own partisan agenda, I'm going to call it out. I said to the people of the state of New York when I was first elected, I'm here to fight for you. That's my job. I was elected Attorney General. I said, I will represent you. I will fight for you. And I will fight as hard as I can for you. Fighting for the people of New York is fighting for the truth for New Yorkers. I'm not going to let New Yorkers be lied to.
It was a communication problem, and he's declared a war on lying, and so that's going to resolve what occurred.
Well, I think if he wants to look for sources of misinformation that misled the public, I think he ought to look in the mirror. For this past year, he has been lauded by the press for his response to the COVID pandemic. He's written about it in a book, what a star he is. He's gotten an Emmy for providing, quote unquote, reliable information to the public via TV. But the fact of the matter is that the governor and his associates made a series of disastrous policy mistakes, and Governor Cuomo is known as being a micromanager. Nothing happens in that administration without him overseeing it and without his approval. And now the cover's been blown on a prolonged and concerted effort by his administration to cover up the worst of those mistakes, and that's the March 25th directive by his Department of Health that compelled nursing facilities to admit COVID-19 patients from hospitals, regardless of whether they had a confirmed or suspected active COVID infection.
Why did he do that? I mean, why?
Well, the explanation at the time was that they were concerned about preserving hospital beds. They were worried that the hospitals would be overwhelmed, and they needed to get people who were medically stable out of the hospital. But you don't do that by putting them into a closed living arrangement that has the most vulnerable people to COVID, and that's the elderly and the infirm. Those are the people who live in nursing facilities and adult care facilities, and he forced those facilities to take those patients back, and he forbade them from testing whether they still had an active COVID infection. It's right there in the directive. The language is really unequivocal that they cannot test, and they must comply. They cannot refuse those folks admission.
There's something else.
And he went ahead on a cover-up, and they directed the state to not count people who had been nursing home patients who were so sick that they got transferred to a hospital and died in the hospital. Those somehow weren't counted. And everyone saw that, the journalists, academics, other politicians. But for 6 months, they stonewalled and would not provide information on how many of those people had been admitted back from the hospitals, and they would not provide information, the true information on how many nursing home facility patients had died.
There's something else, too, that hospital bed shortage was self-inflicted, and this is a way underreported aspect of the story. In point of fact, some 20 hospitals have closed in New York City alone over the last 2 decades, most in low-income communities. Statewide, the number of hospital beds per capita fallen in New York by 13% since 2010, according to the Kaiser Family Foundation, and it was because of the state's mismanagement of the Medicaid program, which occurred not exclusively under Cuomo, but including under Cuomo.
Yeah, but in addition, what he has failed to acknowledge is that the state had other options. They had opened the Javits Convention Center as a medical facility. It was underused. There were many empty beds. They had the Navy ship Comfort as tied up in New York Harbor. It went virtually unused. All those beds were unused. They could have taken in those patients from the hospitals instead of putting them back in the nursing homes. But it was like pouring fuel on a forest fire.
He is Dr. Joel Zinberg, Senior Fellow at the Competitive Enterprise Institute in D.C., Associate Clinical Professor of Surgery at Mount Sinai Hospital in New York, and as somebody who's been one of the reasonable and some semi-lonely voices in the wilderness over the last year. Dr. Zinberg, we appreciate it.
Sure thing, anytime.
Thank you, and he joined us on our turnkey.pro answer line.
The more you listen, the more you'll know. This is Chicago's Morning Answer. Morning Answer on AM 560. The Answer.
If you're an AM 560 listener, one thing I'm certain of is that you're not tuning in to listen to me.